study that we published in Eye. So what we wanted to know if the vitreous or the lack of vitreous impact in the efficacy and safety of DEX implant. So we didn't know that before. And then we compare with what happened with VGF and anti-VGF in vitrectomized eyes. Let's see what we found. So my financial disclosures, I want to thank Professor Lowenstein. She's a mentor. This paper would not have been possible without her. Also Dina Sur, who is here sitting. We write the paper together on the statistical analysis. So it's very easy. So the idea is to have one patient injected without vitreous and check what happens shortly after with the efficacy and safety profile of DEX implant and compare with those who had vitreous, so they didn't have a vitrectomy performed, and check the efficacy and safety of the device. You can see how beautiful after the surgery the DEX implant remains inferiorly. So as you can see here, shortly after when you take the wide field retinography, if the patient has vitreous, the DEX implant will remain superiorly. On the other hand, if the patient had a vitrectomy performed, you can see shortly after, these pictures were taken shortly after the implantation, you can see inferiorly due to the lack of vitreous and the DEX implant went down. But that doesn't mean that they might have the same efficacy. We know from previous studies that the clearance of anti-VGF or VGF in vitrectomized eyes is increased. So in order to treat DME with anti-VGF, we have to keep in mind that the clearance is increased. If you want to start with anti-VGF, you will have to check at least the OCT every 15 days because that patient might need injections more frequently because we need the vitreous in order to work. So as I said, we conducted this beautiful paper published, and as I said, the aim was to check the visual and anatomical outcomes, but also the safety profile in vitrectomized and non-vitrectomized patients. So let's go straight to the results. So we did not find any statistical significant difference between vitrectomized and non-vitrectomized patients, neither in best-corrected visual acuity, nor in OCT measurements. And this was a very nice primary outcome results. And again, talking about safety profile, there was not a statistically significant difference, that is to say, intraocular pressure raises or cataract rate formation. So in conclusion, we can say that we demonstrated similar anatomical and functional efficacy of DEX implant in both vitrectomized and non-vitrectomized patients. And of course, its efficacy has not been impacted by the lack of vitreous. And the safety profile was very well balanced in both groups. So having said that, we belong to the International Retina Group, and on behalf of them, thank you very much for your attention. Thank you.